A bleak day. That was one reaction by government ministers to the first all-out doctors' strike in the history of England's National Health Service, the NHS. The walkout, which began at 8 in the morning with similar action on Wednesday, has been taken by 53,000 junior doctors. They want the government to abandon a new contract, which it intends to introduce in June. For the first time, the stoppage affects accident and emergency, maternity and intensive care.
I'm really genuinely concerned that the government is pushing an already stretched NHS to breaking points, and this is just one of a multitude of steps. I passionately believe in the NHS. I think we have a wonderful healthcare service in this country, and over the past few years I've seen changes made that will result in its demise, and I think this is the latest and the most significant.
Talks between the government and the British Medical Association, which is the doctors' trade union, broke down in January. The dispute is over working hours and pay, with a key sticking point the payments for Saturday. Under the new contract, the amount paid for weekend work will be reduced, but the basic pay is being increased. Two legal challenges are being pursued over the imposition of the new contract.
You can disagree with the government's vision for a 7-day NHS, but is it proportionate or appropriate to withdraw emergency care from vulnerable patients? Because that's what's happening today. The single issue that we couldn't agree on, where the deadlock was over Saturday pay. And we are offering doctors higher premium for Saturday pay than nurses, than paramedics, than the assistants who work in their own operating theatre.
The strike has taken on a sharp political edge, with claims other trade unions are watching the unfolding events. Analysts believe that is one reason why the government will not back down. One media outlet claimed a government source that said the BMA was trying to topple it.
It's not in our interest to go out there, try and topple governments, try and take over, try and be all powerful. It's not the doctors running the BMA. They work in hospitals, they know what it's like on the front line. They're simply trying to put forward what would actually work in practice. Jeremy Hunt's never been on the front line, he's never worked in a hospital, he's got no idea how to run a hospital.
One opinion poll showed support for the strike remains strong at 57%. The changes were part of the Conservative election manifesto, and the government believes no union can sidetrack something on which the British public has voted.